Thanks for joining us for the KSAT News at 9. I'm Steve Sprecher in for Myra Arthur. The number of confirmed San Antonio COVID-19 cases spread by community transmission is now up to 8 tonight. That's according to the latest numbers released by the city. Data released today shows the overall number of confirmed cases stayed at 29, the same as yesterday. Besides the 8th community spread case, 13 are travel related and 4 people were infected through close contact with the travel related case. The causes of 4 cases still under investigation. Meanwhile, there was a new case confirmed today in Boerne. Meanwhile, here in Texas, there are now more than 190 cases and at least 5 deaths. Nationwide, there are more than 15,000 total confirmed cases and more than 200 deaths. A local businessman says it had already been a difficult past couple of weeks when his restaurant was targeted by burglars on Monday. San Antonio police are looking into it, but in the meantime, the owner of Toro Kitchen and Bar says he's trying to move forward and focus on making sure his employees are taken care of during this uncertain time. Our Tiffany Huertas has the story.
It was just very heartbreaking to see that.
As news of the coronavirus has caused fear and panic, Gerardo de Anda wanted to bring some positivity to his restaurant, so he posted this sign. Somebody
to see that sign and to still want to break in was just amazing.
Surveillance video shows the moment 2 people broke into the Toro Kitchen and Bar located near Loop 1604.
When I went inside, I saw that there was a cash register over here by the bar, just all, torn up. And then I saw the wine cellar room open.
De Anda says they took money and food.
They stole a little bit of jamon serrano, some cheese. We're just doing what we can to stay afloat and keep positive mindset.
This area is usually filled with people on Fridays. The restaurant owner says while business is down because of the coronavirus, he hopes things change for the better soon.
I mean, our sales went down, 95%.
Due to the coronavirus, city officials announced restaurants would be limited to carry out orders and deliveries. De Anda says while he's made several adjustments, he hasn't let go of any employees.
We're going to do everything that we can as owners to get them paid up until the payroll that we have, and then we're going to sort of switch the hours and take turns to make sure everybody has some hours at least.
The restaurant will stay open with curbside and delivery options. De Anda is trying to stay positive even through these difficult times.
San Antonio is a great city and everybody always comes together and figure out a way to make it work.
For the 9, Tiffany Huertas.
We reached out to SAPD. They tell us officers will continue to patrol their service areas and take appropriate action. If anyone sees any type of crime being committed, please call 911. The mandatory closure of dining in restaurants and of non-essential businesses by cities and municipalities around Bexar County getting some pushback tonight. Leon Valley's police department says they've been trying to work with businesses who want to remain open. The city approved a local disaster declaration restricting certain activities at businesses to mirror the declaration by San Antonio and the Texas governor. The penalties for anyone who does not comply will go into effect tomorrow. But the police chief of Leon Valley says they have issued warnings to some businesses and made waivers for others so those businesses can continue to operate but still comply with the ordinance.
It's for the safety of everybody, not just the people that are coming into those places, but of the workers themselves. The less amount of people that we can have in an establishment in confined spaces at one time, the better we all are.
The San Antonio Police Department and the Bexar County Sheriff's Office says they have not received any complaints of businesses not following those emergency declarations. The pandemic is wreaking havoc on businesses across the world. Yesterday, the U.S. Department of Labor registered 281,000 unemployment claims. That's an increase of 70,000 from the week before. Here at home, we've already heard of people losing their jobs because of the situation. Earlier today, we reported that the Lily Pad Garden School had to furlough some staff and cut other staff members' hours by half. We also learned tonight that the San Antonio Zoo has had to furlough a majority of its workers. So during this uncertain time, what should you do if your employment has been affected by the pandemic? Well, if you live in the San Antonio area, Workforce Solutions Alamo wants to help. The organization provides services for employees and employers, helping connect them with each other. During a news conference today, Workforce Solution Alamo's CEO says there are several fields that will be looking to hire during this crisis.
Not only the HEBs, but Amazons, but obviously there's going to be need for more medical workers in the medical industry, and that spans the whole gamut of folks. It's not just folks who are actually delivering medical services, but also janitorial services, restaurants, those types of things that are working within those hospitals. But also the logistics, warehousing. As you can imagine, many folks who are staying home are ordering items online, and so there'll be a need for additional delivery types of services and warehousing and logistics.
Because of the recommendations to practice social distancing, Workforce Solutions Alamo recommends you give them a call if you need their services. That number is on your screen right now, 210-224-HELP. 2 school districts vote unanimously to continue to pay employees despite recent school closures. South San ISD and Northeast ISD made the decisions today. Schools will remain closed until at least April 3rd, as ordered by Governor Greg Abbott. Board members expressed thanks to staff members who have adjusted their lives and stepped up as needed. Until further notice, all NEISD and South San ISD meetings will be conducted over the phone. As school districts across the country close their campuses, parents are now forced to turn their living rooms into classrooms. And a lot of parents are now also taking on a new role as a teacher to their children. One local woman says she has been homeschooling her 4 children for 10 years. She offers a piece of advice to parents who are new to the process.
You cannot compare yourself or try to be the school system, because you're only one person. Use it as an opportunity and not as something that, you would look at in a negative.
Use it as an opportunity. Mental health experts say during times of change, it's normal to feel anxiety. They recommended researching breathing techniques and recognizing when to seek help. In an effort to provide public transportation users some relief, VIA is offering free rides through April 1st, beginning tomorrow. Fixed route bus routes, VIA Trans, and other on-demand services, including VIA Link, all included. Of course, the goal is to limit interaction getting on and off the bus to prevent possible spread of germs. So VIA is asking riders to keep practicing social distancing and follow the CDC guidelines for hand washing, sneezing, and coughing. Well, turning to tonight's 9 at 9, 2 men indicted in the murder of an SAISD officer. A trooper helps deliver a baby on the side of the road, and a roundup of how COVID-19 is impacting communities across the world. Here's tonight's 9 at 9. 2 men accused of killing an off-duty San Antonio ISD police officer have been indicted. Alfredo Martinez Contreras and Jorge Armando Lopez have been formally charged in the death of Cliff Martinez. The men accused of running over Martinez back in December as he tried to break up a fight outside of an IHOP. In Florida, found human remains have been tentatively identified as missing Colorado boy Gannon Stout. The 11-year-old was last seen on January 27th. Gannon's stepmother, Letitia Stout, was arrested for his murder earlier this month. Airports across the U.S. seeing more canceled flights, travel restrictions, orders to stay home, and TSA officers testing positive for coronavirus are dwindling the demand for air travel. American Airlines says it plans to cancel 55,000 flights next month. American and Delta each grounding hundreds of planes, about half of their fleets. Meanwhile, President Donald Trump says federal student loan holders can now get their payments paused for 60 days if they submit a request with their loan servicing company. This adds to the president's promise to suspend loan interest during that period, which is being done automatically.
Also temporarily waived all interest on federally held student loans. They'll be very happy to hear that. And I've instructed them to take that action immediately.
A New Jersey state trooper helped deliver a baby while on patrol. It was all caught on camera. The trooper working when a man on the side of the road waved him down to ask for help. The man told the trooper that his wife was inside the car in labor and he didn't think they were going to make it to the hospital in time. The trooper requested an ambulance, and he and paramedics were able to assist the woman as she gave birth to a healthy baby boy. In Minnesota, a Culver's restaurant giving free meals to healthcare workers in light of the coronavirus pandemic.
I'm just in awe of all the positive feedback that we did it, because we didn't do it for the recognition. We did it to recognize everyone and all their hard work in the healthcare system.
Cherry blossoms blooming this week in Washington, D.C. The National Cherry Blossom Festival that takes place every year was set to begin today, but it's been canceled due to the pandemic. Japanese scientists fired a cannonball about the size of a tennis ball from a spacecraft
into a near-Earth asteroid to learn about its composition. Test data suggests the asteroid includes material similar to loose sand on Earth, and the material, once detonated, resettled on the rock, likely due to its own gravity. The test is not only helping scientists learn about asteroids, but also the evolution of how they were formed. Italy has been hit harder than any other country in the world by COVID-19. In a show of solidarity, every radio station in Italy played the country's national anthem at the same time. A resident of Rome shot this video showing the view out his window as the anthem plays in the background. All of Italy has been under lockdown for a week. To read more about these stories, head to KSAT.com.
Well, good evening. What a wacky weather day. Much cooler, a lot of clouds, even some much needed shower and thunderstorm activity. But that shower activity has been kind of dwindling down this evening. And overnight, we'll just have a chance for some spotty showers, mainly well south of San Antonio and the Highway 90 corridor. But it is going to get quite cold overnight. We'll see temperatures fall into the mid to upper 40s across much of South Texas. And when you get up in the morning, it's still going to be pretty gray out there, again with a few spotty showers, mainly south of San Antonio. But we have another good chance of rain coming up tomorrow, especially by mid to late morning. Then through the latter part of the afternoon, a complex of showers and storms moving in from the southwest, moving northeast. We're not expecting really much in the way of severe weather tomorrow, but there certainly could be a few rumbles of thunder, some flashes of lightning, and some heavy rain as these showers and storms move off to the northeast. But just like today, as we get into the evening hours, rain chances will slowly start to dwindle, and then we'll see some improvement weather-wise as we head into the day on Sunday. But with all that rain tomorrow, that's going to limit our afternoon high temperatures to the mid-50s. So another very chilly, gloomy day on Saturday. A great day to stay in and binge watch any of those shows or movies you haven't gotten to just yet. As we get into the second half of the weekend, a little bit warmer, a few more peaks of sunshine, and then the warming trend really kicks in by early next week. Look at Wednesday next week, mostly sunny skies and high temperatures in the low 90s.
Coming up, our coronavirus Q&A. We're going to ask an ER doc some of your questions about coronavirus. We'll be right back. Welcome back. We are trying to combat fear with facts. That's the goal of this new section of KSAT News at 9, dedicated to talking to experts about things you need to know about. Tonight, we're speaking with Dr. Robert A. Frolickstein, an emergency room doctor working right here in San Antonio. He actually joins us from Methodist Hospital. Doctor, thank you for joining us tonight.
My pleasure. Thanks for having me on.
Talk about what the ER is like since this crisis. Have things changed dramatically in the ER where you work?
I would say the volume of patients has dropped a little bit. I guess that's the social distancing thing kicking in, and we're glad of that because the last several weeks has been just filled with lots and lots of preparations, and it's really encouraging to watch the physicians and the team at the hospitals pulling together and preparing for what we're about to face.
Yeah, and I don't want to go any farther without thanking you and your staff and all the healthcare workers out there for all that you're doing and all that you will be doing over the coming weeks. So thank you.
You're welcome.
The first viewer question tonight is, should I go to the ER if I think I have the coronavirus?
Well, that depends. Anytime you think you're critically ill and you're really struggling to breathe or anything where you're critically ill, certainly call 911 or come into the emergency department. If you're doing okay, you just feel sick and you're a little worried you might have the virus, what we're asking, and this is a unique thing, but we are asking people to call their doctor or our group has established a telemedicine program where you can contact one of the emergency physicians and talk to them about whether you really need to come to the emergency department.
Do you have the tests there? Do you have the capability in the ER to do the COVID-19 tests?
So we do have some testing capability. As you know, testing has been severely limited across the nation. It's encouraging to know San Antonio Metro Health Department has some tests. Currently, our testing capability is really limited to patients that need to be admitted to the hospital.
Is that frustrating to you as a doctor that you can't give as many tests as you would like to give, I'm guessing?
Sure. Yes. I think I would love to test lots and lots of people. Other countries had a great capacity to test people, and it really made a difference and helped flatten the curve. You find that once a person knows they have the illness, they are much more likely to do the quarantining, social distancing things that are needed.
When you know you have a patient that has a fever, do you change? I mean, are you putting on gloves? Are you putting on a face mask? I mean, for you physically, what are you doing to protect yourself and the people you work with?
Yeah, the processes at Methodist hospitals are that the patients are screened early on, and any that have any respiratory symptoms, fever. We used to ask about travel. That's becoming more irrelevant. They are considered to be potentially a person under investigation for COVID. And yes, our approach to them is different. We wear a mask and gowns and gloves to protect ourselves potentially from becoming ill.
Have you ever done anything like this before? Have you ever had a situation where you've had to approach it with this much caution, I guess I would say?
Well, back in, I think it was 2009 when the H1N1 was big, we certainly had some of that. I don't recall it feeling the same as this does right now.
Yeah. Okay, let's get to our next viewer question. This person says they're a dental hygienist. Their office is not closing. Are they putting themselves and the general public at increased risk by continuing to treat patients?
Most of the offices, dental offices, physician offices that I'm aware of that are staying open are doing a good job of screening before the patients come into the office. And really, as we know the virus right now, if you're not having symptoms, that's probably a safe thing to do, and I'm sure they're taking the necessary precautions.
The next question is, how can I get tested for COVID-19? I mean, you can't just go out and get a COVID-19 test.
That is correct. There is, again, limited testing availability through the San Antonio Metropolitan Health District, and there are some private labs that offer testing. But again, it's for very specific patients that are symptomatic, that have a flu-like illness. And your best bet to obtain that is to see your personal physician, or if you don't have one, we do have the ability to see you via telemedicine, and if necessary and if it makes sense, we can order or at least refer you to the San Antonio Metropolitan Health District to get evaluated for testing.
When you say if it makes sense, I mean, what are the things that you're looking for that you're going to say, okay, this person needs to be tested, or yeah, I just don't have the feeling like, like maybe it's allergies or something else?
Well, you bring up a good point, because this is cold and flu season, and we're in the midst of some flu and a lot of colds, and this COVID is just like any other viral illness, and so it's very hard to distinguish that on a clinical basis. The real need to test, again, is from a public health perspective, and so as many people we can test, the better off we are. But again, currently, because of the restrictions, there's pretty specific recommendations on who gets tested. It makes sense to me that if you share a home with someone who has some chronic illnesses, it would be very good to know if you had the COVID virus.
I talked to a doctor today who told me that, it basically comes down to his clinical judgment, whether or not, he thinks somebody should be tested or not. But he also expressed some frustration in some of the private laboratories out there that are doing the testing, that it's taking a long time to get those tests back. Have you experienced any of that?
Yes, I think the turnaround time is pretty variable, but some of the private labs are 2, 3, 4, 5 days sometimes. And it's just simply a volume thing. I think they're getting inundated, and it takes, I don't know how long it takes to actually run the test, but it's just when you have so many tests that it creates a backlog.
What's your final, I'll give you the last word here. What would you say to the average San Antonian, average person in Bexar County, South Texas out there that is concerned right now about COVID-19?
Take this social distancing thing seriously. And it's very inconvenient to be in your home and the restaurants are not open and all that, but it is what will save lives. That is what will flatten the curve, as they say, and that just means that if we have so many cases at one time, it will overwhelm the capabilities of the healthcare system to take care of those people and other people that will become ill with the regular things we see every day. If you have a heart attack or appendicitis and the healthcare system is overloaded, that's going to have an impact on your care for those other illnesses as well. So take the social distancing theory seriously. It's really your chance to help save lives.
Very well said. Dr. Robert A. Frolickstein, thank you very much for joining us. Have a great weekend. And I know you're just starting your shift, so I thank you for taking time out to help us tonight.
Well, thank you.
All right, take care.
Appreciate it. Take care.
We'll be right back. A plea for help from a nurse in Bexar County getting a swift response by neighbors. Nurse practitioner Jill Folkert asking neighbors who know how to sew face masks for her office staff. She says the supplies are limited. They've been told that if worse comes to worse, they'll have to start getting creative on how to protect themselves and patients. Her neighbors have started making those masks, and they're going to be ready for use if her office completely runs out.
Right now, we're getting maybe 1 box of masks, maybe per week, sometimes 2 in a week. So right now, we want staff members and the providers to have masks when we're interacting with our cancer patients. But then we also need to provide masks to the patients so that if they do have to go to HEB or their primary care doctor, that they can wear one to protect themselves.
A hospital in Evansville, Indiana actually put together a video and instructions on how to make those face masks using cotton fabric and elastic. But the CDC says these masks should only be used as a last resort and with face shields. Turning to tonight's top stories, millions of Americans told to stay home. New York, California, and now Illinois have closed all non-essential businesses. President Donald Trump asked the former chief economic advisor to return to the White House to help with the economic fallout as businesses are closing across the country. Goldman Sachs predicts more than 2 million filed for unemployment this week. The Trump administration now limiting non-essential travel to and from Mexico. Both countries are agreeing to limit cross-border travel to stop the spread of coronavirus. The Department of Homeland Security says the new measure will not impact trade or commerce. The agency also says it is suspending entry of all migrants seeking to enter the U.S. without proper documentation. Well, tax day is now July 15th instead of in April. Treasury Secretary Steve Mnuchin made the announcement today, which gives Americans 3 extra months to file. Americans who are owed refunds should still file now to get that money to help them through these tough economic times. The new deadline applies only to federal tax income payments, and it is up to individual states to set their own deadlines. There's been a lot of misinformation when it comes to the coronavirus outbreak, and you can't trust everything you see online. That's why the Associated Press has been fact-checking some of the most popular but completely untrue claims surrounding the pandemic for the past several weeks. Let's take a look at this week's fact check. Here's our first claim of the night. Within 48 to 72 hours, the president will invoke what is called the Stafford Act and will order a 2-week mandatory quarantine for the nation. The National Guard will mobilize and martial law will go into effect. Screenshots of text messages are circulating on social media warning that people will not be able to leave their homes. But the National Security Council knocked down these rumors on Twitter, saying in part, quote, "Disinfo is being spread online about a supposed national lockdown. Be skeptical of rumors," end quote. The tweet also advised the public to make sure they're getting their information from legitimate sources. All right, here's another one. Coronavirus remains in the throat for 4 days. Drinking water and gargling with warm water mixed with salt or vinegar eliminates the virus. Here are the facts. Medical experts say that while the virus may be detected in the throat for at least a week after the onset of symptoms, there's no evidence that drinking a lot of water or gargling will actually combat it. The last claim we're fact checking tonight. Some social media users are sharing clips from a video that suggests using a blow dryer to shoot hot air into your sinuses will kill the new coronavirus. But medical professionals say not only would this not kill the coronavirus, it would also be dangerous. Stick to the hair on your head with the blow dryer. New tonight, Governor Greg Abbott has pushed back the May 26th runoff elections from May 26th to July 14th. This is being done in an effort to combat the spread of COVID-19. Early voting for the runoff will now begin on July 6th. If you need a refresher of what will be on the ballot, go to KSAT.com and click on the Vote 2020 section under the News tab. We'll be right back.
Hey guys, time to take a look at a couple of stories that are trending today on KSAT.com, and we start with a viral video of some spring breakers that just could not curb their hard partying ways. So the pandemic did not stop these people from partying on the beach, and several photos and videos have been shared on social media of several spring breakers en masse in places like Florida, South Padre Island. So in the video that has gone viral, one spring breaker, actually says, "If I get Corona, I get Corona." This is the youth of America, people. And another said, "You know what, we're just trying to get drunk before everything closes." So this has actually bothered a lot of people, including Michael Dell. Yes, Michael Dell of Dell Computers. He tweeted that anyone in the video, please do not apply to work at his company. It was a little bit harsh there, but yeah, they've been getting a lot of backlash, including from Trevor Noah. Also had a couple of interesting things to say about it. So you could check out this story on KSAT.com. All right, moving on here. For the people that are staying home as much as possible, thank you very much for that. Local restaurants have stepped up to reward those practicing social distancing by offering them deals and to-go orders. So these deals range anywhere from things like fries and a canned soft drink when you buy a burger at Papa's Burgers to kids eating for free at Sea Island. There are also places offering free delivery if you do not want to go out. Chipotle is one of them. Rudy's is offering 25% discount. Pretty cool there. And the Rustic and Whiskey Cake are a couple of places that have started these quarantine and chill survival packs, because we all need some help right now. So if you want more information on this, all you got to do is head over to KSAT.com and look for that article there, which has a long list of restaurants. All right, last story trending today. Speaking of stepping up, my dude right here, San Antonio native and best-selling author Shea Serrano, is doing some serious good right now. For the past week or so, if you follow Shea, he's been helping people pay their bills online. So he started paying people directly through Venmo and Cash App, and his followers have also jumped in to help raise money or to just directly send money to those that have been hit pretty hard by the coronavirus pandemic. So he was profiled in the New York Times. They interviewed him. And also President Obama, yes, Barack Obama also gave him a shout out, tweeting that Shea has used his fee to directly support people and help shift our ideas about how to approach giving. Good stuff there from Shea Serrano. Look, I'm gonna humble brag just a little bit here. I interviewed Shay a few weeks ago. He loves his followers. He's always talking about how great they are. And when I asked him about a week ago when he first started this, he said that he just didn't want people to really feel bad anymore. And that was really the only reason he did it. He said that people were feeling bad and he didn't want that. So that's just kind of the way he is. If you want more information on this story, head over to our website, KSAT.com, and remember to stay safe out there.
Happy Friday. So for the time being, rooftop weather has become Katie's unimpressive patio weather, but there will be appearances by Theo the cat. And yeah, this is weird, not our typical setup, but we're gonna make it work just like you guys have been making it work from home all week long. All right, Theo, let's tell him about the weather. Tomorrow, Saturday, is gonna be a lot like Friday, cloudy and cool with chances of rain. We'll have some more scattered showers and storms around. Sunday, not as much rain, a little bit warmer, highs near 70 with a few peaks of sun. It is good. Parkour. Parkour for your minnows. Parkour for the minnows. Right here. Parkour. That wasn't very good. Say bye. Goodbye. Have a great weekend. See you later.
All right, just a reminder, we'll continue to follow all of the latest COVID-19 developments through the weekend. Just go to ksat.com/coronavirus. That does it for the 9 o'clock news for all of us here at KSAT 12. Have a great weekend. Good night.